stroke does not mean severe pain, but can bring about symptoms such as visual or speech impairment or paralysis in arms or legs. The patient has to have immediate emergency treatment in hospital. The hospital stay is then followed by a period of rehabilitation in a calm and beautiful resort such as Davos or Wald Zürich. The timing of rehabilitation is crucial. At an early stage, the patient has to relearn his motor activities and integrate them into his daily life. The goal of a subsequent ambulant treatment is to achieve domestic and social independence and reintegration into society.
I am a former dancer from Brazil, and I am in Zurich doing part of my rehabilitation because I had a stroke, and I'm also teaching dance to stroke patients at the Tsar.
The Outpatient Rehabilitation Center in Zurich, abbreviated Tsar, is a novel institute that offers different types of rehabilitation therapies to patients with strokes or other brain injuries in an outpatient setting. It combines different therapeutic aspects, including speech therapy, occupational therapy, physiotherapy, and neurocognitive training to improve all the deficits a patient after a stroke or a brain injury may have.
We do not treat simply an arm or a leg, but a whole human being like a teacher, a mother or a ballerina. In this overall context, the therapists have to find the right goals with the patient that fit the patient's needs best.
I did a lot of basic research on manually assisted locomotor training, and that is how we developed the idea to create a robot that could do this job automatically. We founded a spin-off company, Hokoma, and since 2000 we have been further and further developing the device. And of course it was developed for spinal cord injury patients, but it has a huge potential also for stroke. And that is why we are very happy that today, besides the Uniclinic Valguist, we also have other research partners like the Tsar here, because it is very important to have also the clinical experience and the research background with these stroke patients.
Therapy robots help patients to execute movements better, and through this intensive and repetitive stimulation, the brain learns to execute the function faster. Der Lokomat hilft einem Patienten, der das sonst nicht machen könnte, zu gehen. The Lokomat helps patients who normally could not walk to actually walk. We can lift off body weight and slowly lower the patient on a treadmill, and then we can slowly add more weight. While the robot carries out the movement, the brain does not really learn much, but as soon as the patient becomes more active, engages more and executes slowly the movements himself, the brain starts relearning the movement again.
I feel very good that I can walk very symmetrically, and that I don't have to worry so much about my balance, and I can just feel the movement in my legs.
Armeo takes some of the weight off so that the patient does not have to lift the entire weight of the arm to make a movement. The screen of Armeo gives an exercise, like for instance catching raindrops with a cup. The patient executes this with the eyes. The main goal of this exercise is to combine the visual system with the locomotor system.
Mit dem Armeo-Power kann der Patient seine Betroffene sieht.
With Armeo Power, the patient can use the impaired part of the body which he otherwise avoids and exercise it intensively. He can also do repetitive exercises and had the possibility to solve different tasks in different intensity levels. The combination of orientation, problem solving, intensity and repetition of exercises is crucial for the brain to relearn lost functions and movements.
Das weiß man, dass es hilft dem Patient, die Funktion zu wiedererlangen.
It has been proven that by stimulating the brain to reorganize itself, it will relearn lost functions and movements much faster.
I think a stroke is something that changes the life of a person significantly. I had to stop and revalue things in my life. You know, it's so huge that I don't think it's easy for anyone who has not gone through this to imagine how complex and what an impact it is on someone's life. With such a slow rehabilitation process, you have to really recognize the small victories of every day, you know, and be happy that that little thing got better that day.
In the therapy center of ZAR, occupational therapists, physiotherapists, speech therapists and neuropsychologists work closely together in order to reach the common goal together with the patient. We orient ourselves on the research results on cognitive and locomotor learning. We see each other regularly here at ZAR and exchange information and experience. We also have a tool which is an interdisciplinary report. In an early stage, there is in-depth talk with the patient to see where the problem lies, what has to be improved, and which functions and movements in particular the patient wants to relearn. We also practice alternative methods such as a more playful approach and group therapy.
Rehab dance is really good for the patients. It's been great being able to work with them and also just seeing how they can progress, and also in a different content. Like, not in physio you do a lot of working on little special things, and with this rehab dance it's more the whole idea.
Okay, now just follow me. Heel comes through the leg. And down and the other. So try to feel your ankle on your leg.
The biggest success factor is motivation and the ability to arrange oneself in harmony with a changed body. Success will be achieved when new and creative ways are explored together with loved ones, family and friends.
I was already a dance teacher before I had a stroke, and then after my stroke I decided to look at how I could use dance to improve movement for stroke patients like me. Not only do I see an improvement on the patients that are dancing with me, but also on myself, on the way that I look at dance, the way that I look at aesthetics of movement, and the way that I see that people who have not been highly trained in a technique such as classical ballet, which is my case, can also create and improvise and come up with very beautiful movement. I don't know if I'll be a ballet dancer again, because my view about dance has changed so much that I don't know if that would be my first choice.